polycystic ovarian disease presents with irregular menstrual cycle. Say that normal menstrual cycle is between 21 and 35 days. So if your menstrual cycle length falls between 21 and 35 days, it's said to be normal, no matter how it comes per month. However, people with polycystic ovarian disease present with prolonged menstrual period. You see the person, someone that has polycystic ovarian disease, will be seeing her period after 35 days. And sometimes most of them see their period after 3 months. And what happens is that the uterus, because there is no ovulation, the uterus overgrows on its own. The endometrium overgrows. There is nothing that is regulating it. So when it overgrows, it sheds. When it overgrows, the supply is shed. So that's why it will continue to grow for the first month, second month, third month, and sometimes it will shed on its own. Other smaller percentage of those that have polycystic ovarian disease does not even see their period for 1 year. And so if you don't stimulate menses, the person may not see her period. So if you have any issues with your menses, especially prolonged menstrual period, it's likely that you have polycystic ovarian disease. Now, the second thing is, you see someone with polycystic ovarian disease, most of the times they gain weight. It is not their fault. So someone with polycystic ovarian disease will come with this overweight or obesity. Sometimes they appear very estrogenized, look shining, because there is high level of estrogens produced by the ovaries in this patient. So they are big. The second thing is that you see them growing hairs in abnormal places. Someone with polycystic ovarian disease, you see the person growing beards, growing even this one, and you see their skin, most times they are so hairy. Then you see abdomen, on the chest they have hairs, on their abdomen they have hair. So we call it male pattern of hair distribution. It is because of the hormone androgens. They have high levels of male hormone. So someone with polycystic ovarian disease can present with this abnormal hairs distribution on their body. Now, another presentation of someone with polycystic ovarian disease is change in voice. The same mechanism of high levels of androgens causes them to have change in their voice. So their voice tends to become the male type of voice. Then the next presentation is inability to conceive. That's the commonest cause of infertility. You see a young woman of childbearing age, one of the commonest presentation is inability to conceive, and the person is coming with, he has been trying to get pregnant, he can't even calculate her ovulation. These are symptoms to show that someone has polycystic ovarian disease. And percentage of people with polycystic ovarian disease, when you press their breast, you see breast milk discharge. So they have also hyperprolactinemia. So polycystic ovarian disease has to do with hormonal imbalance in a woman of reproductive age. And when you now go further to do investigations, when you do the hormonal profile, it will be abnormal. During a hormone, we check for the follicle stimulating hormone, luteinizing hormone. There's a reversal of the ratio. We also check for estrogen and see how high they are. We'll go on to check the prolactin to see if the person still has hyperprolactinemia. Then if you do an ultrasound, especially transvaginal ultrasound, to look at the ovaries, you will see these ovaries arranged peripherally in cystic form. They are filled with fluid, so none is dominant, none is going to ovulate, and none comes out for ovulation, and that's why pregnancy does not happen. So they are arranged like in necklace appearance, and sometimes the ovarian volume is high. So someone with polycystic ovarian disease can present with this. Now, treatment for polycystic ovarian disease is relatively simple. Most times when they present to the hospital and if they are evaluated and this diagnosis is made, the person goes on to be treated, and if the person wants to get pregnant, she conceives her baby. Some people with polycystic ovarian disease has to be induced for ovulation for them to get pregnant each time they want to get pregnant. So someone with polycystic ovarian disease has to be reviewed regularly, even after pregnancy, because there are other medical conditions that can be seen in that person if the person is not well managed. So thank you for watching to this point.